Welcome everybody. My name is Parvez Aslam. Those of you who know me personally and those of you who don't, I live in Chesham in Buckinghamshire in England. Welcome to Minutes to Save a Life, and it is my absolute great pleasure to be hosting this event. And if I give you a little bit of background while people are joining us, as I said, we've got over 200 people joining us today, and because of technology, they will be slowly joining us, and I hope that the session will be fruitful for them. We started off with our local community in Chesham in Buckinghamshire, bringing about an awareness. So we thought that 50 would be great and online. We then had a whole load of people saying that why can we not do this with a few more to around the country. So we got to 100, and this afternoon we hit 250 plus. So thank you so much for all the people that are joining us and those of you who are joined. It is, when I say it's my pleasure, I'd like to give you a little bit of background why I did actually organize this event. For two reasons in particular. One was my involvement in the community as the project manager for lots of things. And the other reason was personal ones in particular. And lots of you who've contacted me have said that the reason why you're on here today is because of personal who are actually quite professionals in there. We've got doctors, solicitors, lawyers, people who are first aiders. And just like myself, we're here because we want to bring about, rekindle our knowledge on the stuff that we already know, and perhaps we can gain something from it. I've also asked a few people to actually join me today because I wanted to get feedback from you to how future sessions could run. So I said to you there were two reasons. The first reason was that my involvement with the Club Cricket Conference, I was, as the ex-president of the South East Sunday Cricket League, I'm involved with sport quite a bit. I was invited to a lunch at Lord's to the Club Cricket Conference charity event, to which they were raising lots of money for all sorts of things. And in particular, they raised £100,000 for defibrillators to be distributed around the country to the cricket clubs. And they asked me, together with other people, if I could help do this. And so I joined in with the National Asian Cricket Council to distribute these defibrillators and to train them. So that's where I met my great friend now of the Community Heartbeat Trust, Martin, where we trained people at Lord's, and then we went further afield in the community to train people to not only have the defibrillators there and where to put them, but also how to use them. The personal one, and the other reason why I said I would join this, is that my niece, who actually is in the final year of a medical school, she directed me to an organization called the British Islamic Muslim Association. So last September, she said to me, "Uncle, is there any chance that can you go and have a look what they're doing?" And if I'm honest with you, I was blown away. This was online. So in September, we're not really going out online. It was absolutely fantastic. Now, on my personal point of view of why I did this. Some of you may or may know, who are very close to me, that I had a tragic fall whilst I was shopping, and I had my bags, both hands were filled with my shopping, and I was minding my own business, just leaving a store, and accidentally someone tripped me over. I went flat on the floor, face down, nosebleed, head concussed, and I was actually really quite disturbed with my arms actually pushed into my ribs, and my ribs were fractured, and nobody came to my aid. Now this happened in May, and I can understand people not coming, but there were people around me who were so frightened to do anything. Now, one person came over to me, picked up my skin and said, listen. She didn't know me. Listen, here we are. Here's your belongings. I'm going to put it here. Please make sure there's it. And I said to her, thank you so much. Now, because I was knowledgeable, I was able to lead a few people to tell them what to do. So I said to them, please, can you get me a chair? And the person says, shall I call an ambulance? I said, yes, please call an ambulance. I was knowledgeable, so I was able to help myself. And another situation was there were a number of cases throughout all my time of cricket and tennis that I've had colleagues who have said to me that they were in a position where they were absolutely helpless, where they could not perhaps help somebody in order to whether they were knowledgeable or not, they just didn't have the confidence. So we are here today because that we want to become a little bit better in what we already know and learn other things. And finally, my huge thank you to the people who promoted this event and to all the people who are actually here by word of mouth. But I want to say a huge thank you to UK44 and Dunya Channel, which are the TV channels that have promoted this and are going to do this afterwards. And finally, the Chiltern Voice, the BBC Three County Radios, the BBC Breakfast and the Wickham Radio who helped me advertise. Now, I said to you, the community heartbeat is at the center of this. So I'd like to take you through a presentation about today and about Community Heartbeat Trust. It's really important for us to know that where do we go after all this training, and we're going to be taking you through this. So the National Heartbeat Trust is a national charity, leading charity in the development of community defibrillators and training all around the country. And in particular, it's advisors to NHS England, it's NHS Wales, and a member of the Save a Life, and also SALC, and also the RC UK, which is Resuscitation Council UK. The order of events today, you'll be pleased to know that this will be the only time I will actually speak to you, and then I shall speak to you later on. So we're going to be looking at why learning basic life support is really important. We'll be looking at what happens when you put somebody in the recovery position. Then cardiopulmonary resuscitation, CPR, what does that actually mean and what do we do about it? We'll be looking at the management of choking. And that's one particular one that I put in with that. That's not usually in any of the sessions that you might actually attend. But choking is a really important one for people to know what to do. And then we'll be looking at the using of the defibrillators. And then we'll have a plenary. We've got a lovely little quiz. And then we'll tell you how to get your certificate and also where to go after that. Now, this is really important. I said to you that whilst I was knowledgeable, and I would say that I was fortunate that I got out of that tragic thing, because I could have actually, I was going to say this to you, I wasn't breathing very well, my ribs were fractured, I could have died. But identified and managed. This is the words that you need to really understand. The aims of today's session is not only to manage yourself and identify, but for others. So we're going to be looking at what happens that if an individual is unconscious and is breathing. Think of this very carefully. You put them in the recovery position. But if they are unconscious and not breathing, then you don't do the recovery position alone, you do a CPR. What happens to someone who is choking and what do they do? And then finally, we'll be looking at the defibrillators and how they are used and what we can do about them. This is a disclaimer just to make sure that everybody's aware that when we put this together, this training is for awareness only, is an education only. So the training does not certify anyone for basic life skills as to become a trainer or to attain official basic life skills certificate. Final few things to just say to you, please turn on your cameras when instructed, because we'll be asking you to do things and we want to have a look. Please keep your mics muted, and thank you for doing that at this present. And then if you happen to fall out of a link, then just come out of it and then rejoin us by the email that we've sent you. Now, I will say to you that I could not have put this together. You can just imagine that although it's online, it is really essential that all of these people need to be recognized. I have got these wonderful doctors, and also Martin Fagan from Community Heartbeat, got Habib from Brighton, we got Husna from Barts, and we got Tanya from King's. These young people, and also Martin, you're also young as well, as I am, we're all young. We've been working for months. But these young doctors in particular have been doing their night shifts and have been the front line. So I'm hugely grateful. And finally, I just want to say a huge thank you to Joe, who's been working on the technical parts of this. And I'm very grateful for we're able to do this on Zoom. Now, it is my pleasure to introduce you to the first aspect of our training, and that is why learn basic life support. So I'm delighted to introduce to you the young Habib Said, who's going to take you through the next session. Thank you.
Thank you for that very generous introduction, Parvez. Welcome, everyone. My name is Habib. I am a junior doctor currently working down in Brighton. I'm in my first year of training as a doctor. And yeah, it has been a bit of a baptism of fire with the whole COVID and everything going on. But I'm delighted to be here to give you guys a rundown of some of the basic life support skills that I'm so passionate about and have been teaching for quite a few years now. And I hope you'll find this session useful. So the way I wanted to teach is what I like to teach. I'd like to make it interactive, but I also like to use a lot of pictures so that people get a good idea of why it's important to learn such skills. So I'll just start with the very basics of what is the purpose of the heart. As you're all aware, this is the heart on the left-hand side of your screen and is an essential organ in order to pump blood to the rest of our organs around our body. Now, in cardiac arrest, the heart stops pumping, and so we can't get any blood to the very vital organs such as our brain, our lungs, and also our liver. So eventually what happens if we do lose blood flow to these particular organs, unfortunately, a person will die. I just wanted to highlight some statistics around cardiac arrest. Around 88% of cardiac arrest happens outside of hospital. And unfortunately, only 1 in 10 people of these people having cardiac arrest out of hospital survive. So it is so crucial that we are aware of some of the basic skills required to save a life. Now, when we teach about basic life support and CPR, we think about the chain of survival. These are seen as 4 key steps that are required to kind of save someone's life. So the first step is early recognition. So being aware of some of the signs that you may see in a person who is having a cardiac arrest, something in which we'll be covering in our next slide. Calling for help early, so calling 999 as soon as you can. It can really make a huge difference in terms of getting an ambulance out to you as quickly as possible. Next step is starting CPR as early as you can. So we know that for every 1 minute delay to CPR, a person's chance of survival decreases by 10%. So it's so crucial that we intervene as early as we can and we start the chest compressions. Early defibrillation is the next step. This is something that one of my colleagues will be covering today. And so we will be able to teach you about defibrillation and how to use the machines. And final step is that once someone has a cardiac arrest, they will most likely need some time in an intensive care unit in hospital. So I posed the question to you guys now. This is the interactive part. How would you tell if someone is having a cardiac arrest? Could you, for the next 15 seconds, discuss with some of your people you're next to right now and post it in our chat box? Any ideas? I can see some chest pain, pain in arm. Okay, good. So it seems like a lot of things that people are suggesting are perhaps more to do with a heart attack, which is a very common misconception. Let's see if my slides are working now. So these are 4 key symptoms and signs that I think people do need to be aware of when someone is having a cardiac arrest. So if someone just mentioned that sudden collapse. Yeah, so if someone just suddenly collapses in front of you, you need to be worried if whether they're having a cardiac arrest or not. A person who's unresponsive or not breathing or have some very irregular breathing, that's when we're also concerned that their heart may not be working. And finally, so someone looks very pale to you, or their extremities, their fingers are blue in color, or they have blueness around their blue coloration around their mouth, then you're concerned that the person's heart is not pumping effectively. So a lot of people did mention some symptoms of a heart attack. Now, the thing is to bear in mind, a heart attack is not the same thing as a cardiac arrest. In medicine, we look at heart attack as essentially a plumbing problem. So when people do not have adequate perfusion to the heart due to a blockage of the blood supply, that's when you start to get these symptoms, a very central chest pain, which radiates down to your arm. It can radiate up to your neck and also to your jaw as well. Whereas a cardiac arrest The most common problem is it occurs due to an electrical problem with the heart, and it can suddenly stop. Although a heart attack can lead you to having a cardiac arrest as well. So, what would you do if someone collapsed in front of you? How would you approach the situation? For the next 15 seconds, just type into the chat box and what you would do if you were faced with a person who's collapsed in front of you. Okay, good. Yeah, so I can see someone mentioned check it safe, check the breathing. Good, all very good suggestions. So when we think about assessing someone who's just collapsed or is unwell, we like to keep it simple in medicine. We like to use acronyms. So the one that we use typically is called Doctors ABC. So as some of you may mentioned, the first very important thing to do is to check for, is it safe to approach? So that's what danger is. So the number one priority is to make sure that you are safe as well. So if someone is in the middle of a very busy road with cars going past, you don't want to go in the middle of the road and try performing CPR because you're putting yourself at risk. You want to wait until the cars stop and it's safe for you to approach the situation, because you do not want to put yourself at risk. The next thing is to check for the response. So simple things such as giving them good old shake just to see if they can respond, or just trying to talk to them and see if they can vocalize. But if someone is not responding in that way, other things you can do is you can give them using your fist, you can give them a rub across their chest like this, which is a painful stimuli, and people should respond if they are alert. Or you can give them a squeeze onto their shoulders, which is another painful stimuli, and that can also stimulate someone if they are sleeping or not very alert at that time. Now, if you do not get a response at this point, you'll start to get concerned. And at this point, you need to shout for help. So get a passerby to help you out and start calling 999, and you should proceed with the rest of the steps. So the next step is to check their airway. Now we can do simple airway maneuvers. Let's see if it works. So we can do simple airway maneuvers, such as something we called head tilt chin lift. I have a picture, should come up now. It's not working. Oh, next slide. Thank you, Joe. So we have a maneuver called head tilt chin lift. So here, as you can see from the picture, that you place one hand on their forehead and then two fingers below their chin. And you simply tilt their head backwards, and this makes sure that the airway is nice and open. What you want to do next is, once you've secured the airway, you want to see if they're breathing. So this will dictate what your next steps will be. So with breathing, we like to approach a look, listen, and feel approach. And we want to do this step for a maximum of 10 seconds, no longer than that. Okay. The simple things you can do is just by taking your finger. If you go to your Adam's apple, if you go 2 to 3 centimeters to your left or right, you can feel your carotid pulse. So if you try feeling the pulse on the unconscious patient and seeing if you can feel a pulse, this will indicate that if their heart is beating or not. Other things you can do is that you can see if their chest is moving up and down at the same time as you've got your finger on their pulse to see if they're breathing. But be careful not to be too close to their mouth, because due to the COVID changes, and there's a risk of you getting COVID from a patient who you do not know the COVID status of. So try to avoid getting too close to the person's mouth. Now the next step is if all of that is not working, they're unconscious, they're not breathing, then you need to be starting CPR. And now one of my colleagues will be going through CPR with you at the later point in the event, and we'll cover that then. Next slide, please, Joe. Another important point that we wanted to emphasize and make clear is to how to call 999. So a lot of people may think they know how to call 999, but only 5% of people have actually done so. So some of the key questions the operator will ask you, the first thing is that you want to know which service you want to call. The first thing you would say it would be an ambulance, and then they'll ask you two simple questions. Is the patient breathing, and are they conscious? Now, based on your previous assessment, you'll be able to tell whether they are breathing or unconscious. And then if they're not, if you'll note both of those questions, the operator will tell you to continue CPR until help arrives. If you're with someone else, they may get you to get the other person to go collect a defibrillator from a location nearby, and they'll give you instructions on how to access that defibrillator. So finally, I just wanted to highlight some changes which have happened to the basic life support algorithm due to COVID. The three key things is to make sure that you're not too close to the person's face, and try to cover their face with either a cloth, or sometimes if you're in a public place and you have nothing with you, you can take their t-shirt and pull the t-shirt over their head just to cover their face, and so that you're not generating any aerosol generating particles. The other things you should do is that usually with basic life support, we tend to give mouth to mouth. Now, of course, due to the COVID risk, we're making sure that we just do chest compressions only. Studies have shown that effective chest compressions are far more useful than doing any sort of rescue breaths. And finally, after you've done all the cardiopulmonary resuscitation, you need to thoroughly wash your hands with hot warm water and some soap. Thank you very much for listening for my part. I'll be passing you over to my colleague, Hosna, who will be taking you through recovery position.
Thank you, Habib. So for those of you who don't know, my name is Hosna. I'm a fifth-year medical student at Barts in London, and I'm going to be talking you through how to put someone into the recovery position. So what's important to know is when you'd want to put someone in the recovery position. So this is when we come across a casualty, perhaps in public, perhaps at home, and they've collapsed. They've collapsed and we've assessed them. We've realized that they're unconscious, so they're not responding. And secondly, they are breathing. They are still breathing. So we want to help them to recover by putting them in this position. There's a few reasons for why this can happen. Barring any serious medical problems, some common reasons are low blood sugar. Someone might collapse because of low blood pressure. They may have just fainted, or they may have an irregular heartbeat. So these are some of the common problems that can lead someone to fall unconscious but continue breathing. Okay, so we're going to run through a scenario together. So whilst taking a walk, you come across someone lying in the middle of the pavement. They don't seem to be conscious. What would you do? So just take 10 seconds to talk with your partner or your family member about what it is that you would do first. What's the first thing you would do to approach the situation? And if you want to, you can also type your answer in the chat box, and then we'll talk through it together. So I'll just give you a few seconds for that. Okay, assess any danger first. Yep, that's true. Okay, let's go through the answers now. Yep, so all your responses are really good. So call out to them, check for danger, check if they're breathing. Good. Okay, so what we would do is doctor's ABC. So if we go through it step by step, D, we look for danger. See if there's anything around them. If there was something that may have caused them to fall unconscious, it may also be a harm to us. This is why it's important to check for danger. Secondly, R, response. We want to call out to them, see if they can hear us. If not, rub their chest or give them a squeeze on their shoulder, see if they will respond to us. If not, we want to shout for help. See if there's anyone around who can also call 999. If not, this is the moment in which you would call 999. A good tip is to leave the phone on speakerphone so that you're still able to help the person whilst talking to the ambulance service. And then we check their airway, head tilt and chin lift. So make sure that their airway isn't blocked and they're able to breathe. And at B, we would check their breathing. At this point, we would realize that their chest is rising and falling, or we can feel their pulse, or both. And at that point, we'd realize that they're breathing. So they're unconscious and breathing. So we want to put them into the recovery position. So the first thing we do is we'll kneel beside them. It doesn't matter which side you kneel beside them on. you can kneel beside them on the left or the right, whichever is closest to you. The second thing you do is look around them to see whether they have any sharp objects. So gently tap their pockets, see whether they've got any sharp objects, keys, Swiss Army knives. Also, if they've got glasses, any of these things, just remove them and place them to one side, and we'll deal with those later. Second step is to position their arm that is closest to you. And we're going to lay out their arm perpendicular at a right angle like this, which I'll show you in the demonstration later on. The third step is to position their other arm by raising it across their chest and placing it against their cheek like this, making sure their palm is on the outside of their cheek. The fourth step is to bend their knee that's furthest from you, dragging their foot along the floor, and that will act as an anchor point so that we can then gently roll them towards ourselves with that bent knee. And once they're rolled over, we want to just readjust their position slightly, check that their airway is still clear by doing a quick head tilt, chin lift, making sure their head is supported by their hands so that they can continue breathing and they're in a comfortable position. And finally, we want to stay with them and monitor. And this is really important, if not the most important step of this whole process. If we can stay with them and monitor, they may become worse. They may stop breathing, at which point we'd have to do CPR if help hasn't arrived by then. So make sure that you stay with them and monitor their condition. Okay, so now I'm going to do a quick demonstration, and I'm going to show you guys my full camera. If you have a partner with you, if you're practicing with your family at home, you can also practice along with me. I'm going to be demonstrating this twice. The first time slowly talking through each step, and for the second time you can also move along with me and see how you find it. Okay, so I'm going to put you guys up here, and hopefully you should be able to see my sister, who is ready for this demonstration. So I'm going to kneel beside her, and I've already established that there's no danger. She's not responding to me, and she is breathing. So the first thing I want to do is check for any objects. I'm going to gently pat her pockets, and if she's wearing a coat, you can tap those pockets too. And she doesn't seem to have anything in her pockets, but she is wearing glasses. So we're going to gently remove those glasses and fold them up, and I'll show you what to do with these later. So the first step we want to do is take the arm closest to me and place it at a right angle to her body and leave her palm facing upwards. Now we can place any belongings that she had, including these glasses, into her hand and fold them up, so when she does recover, they're in her possession and they're not in her way or harming her in any way. The second thing we want to do is take the arm that's furthest away from us, take it across her chest, open up the palm, and hold her arm with her palm against yours, gently like so it doesn't come off. Then we want to bring the leg that is furthest away from us upwards, and this will be the anchor point which we will use to roll her over. And at this point, we're going to gently roll her over. Okay. Now we're just going to quickly readjust to make sure that this leg is at a complete right angle. This is an anchor point for the body so that she doesn't continue to roll over. And do a quick head tilt and chin lift so that her airway remains open and the blood is flowing throughout all her body, so she'll be able to regain consciousness if blood flow was the problem. Her possessions are in her belonging, and I'm going to stay with her and monitor her, continuously check if she's still breathing or if she ever stops breathing. Okay, so we're going to do that one more time and slightly faster so you guys can practice along with me. Okay, so I've assessed the danger, there's no danger. I've called out her name and she's not responding to me. I've given her a chest rub, she's not responding to me. But I've checked her airway is clear, and I've checked her breathing. I can see her chest is rising and falling, so she's definitely breathing. Now I want to put her in the recovery position. Checking her pockets quickly, nothing there. Let me take her glasses off and put them to the side. Taking the arm closest to me, place it at right angles, and opening up her palm, placing any belongings in that hand. Taking the other arm furthest away from me, pulling it up to the side of her cheek and placing my hand against it. Bring up the leg that's furthest away from you, bending it like this, and gently roll her over. Now I just want to quickly readjust her positioning so we can make sure she doesn't roll over further, and bringing her head up and tilting her chin so that her airway remains clear. And I'm going to stay with her and monitor her and wait for the ambulance to arrive. Okay, thank you guys. You're done. I'm going to bring you back now. Thanks, Joe. Okay, so let's run over some key points for why it's important to put them into the recovery position and why it's beneficial to them. So you can see at the top here, her open hand supports her head. One of the most important things about the recovery position is that we make sure that her head is tilted and her chin is lifted up so the airway remains open. This is important because sometimes the tongue can fall back and actually block the airway, and that's a common thing that can stop someone from recovering. This position helps with that. The next thing we can see is that her bent knee over here, or in this case, it's a guy, so his bent knee over here stops him from rolling over. And if he does roll over, he'll be flat on his tummy, which isn't a healthy position to be in if you're trying to recover. So that's the point of this bent knee, it acts as an anchor. We've also removed any bulky or sharp objects from the pockets, or if they're wearing any glasses, and putting them in their hand for safekeeping. And finally, her airway is clear to breathe. Okay, so now I'm going to hand over to Tanya, and she's going to be talking to you about what to do when you find a patient or a casualty who is unconscious and not breathing.
Thank you, Hisna, for talking us through the recovery position and for that excellent demonstration. Do say thank you to your sister as well from us. So hi everyone, my name is Tanya Usman and I am also a fifth year medical student but at King's College London, and today I'm going to be talking you through cardiopulmonary resuscitation, in what situations to do CPR, and then this will also be followed by a demonstration by Habib. So let's move on to the next slide. So if we start off with a scenario, you see Mrs. Jones, who has suddenly collapsed on your local high street, and there is no one else around. So we've gone through this a couple of times now. So I'm going to ask you guys, what would you do in this situation? Please do use the chat box or discuss it with your friends and family. Great, so doctors ABC, exactly. So as you can see, these are the principles we use, and you can never really go wrong if you use this. So what would you do when you're checking for danger? What would you do in particular? So this is the easy step, really. So you're just looking around if there is any danger. Exactly. If you're in the middle of a road, like she is, if there's any traffic, or if there's anything else that might pose a danger to Mrs. Jones or yourself. Next, you check for response. So like the others have said, you would call out her name. You might not know that her name is Mrs. Jones, but you might call something out. You might shake her shoulders. You may pinch her shoulders as well. And then you find out that Mrs. Jones is actually not responsive. So then you would shout for help. It's really important, especially in a scenario where you may have to do CPR, to shout for help, because doing CPR can get really exhaustive, as I'm sure Habib will show you. So then we move on to airway as we have done before. So in this case, she is unconscious, and if we check her airway, her airway is definitely open. So you've done the head back and chin lift, and you find that her airway is clear. However, you look, listen and feel for breathing, and she is not breathing, and you've checked her carotid, you've checked her pulse up here as well, and you can't feel it. So what would you do in this case? Anyone? So she's unconscious and not breathing. Yeah, so you would commence CPR without delay. Great. And yes, this is a great opportunity to call the ambulance as well. So call the emergency services so that they are on their way, because once you start chest compressions, you might not have time to do that. So positioning is really everything with CPR. And I'm going to talk you through what some of the key features of doing effective chest compressions is. So we want, when doing chest compressions, before you start, place your hands at the center of the chest. And a good way to know where the center of the chest is by looking at the casualty's armpits. So if you look at the casualty's armpits, which are here in this picture, and then place your hands in between these at the center of the chest, you know you're in the right place. Then you use the heel of one hand, doesn't matter which hand really, and you interlock your fingers with the other hand on top, and place yourself vertically above the casualty with your arms nice and straight, your back nice and straight. And really, when you're doing chest compressions, the key is to exert all of your weight on top of the casualty with each chest compression. And this is how you know that you're doing effective chest compressions. And stay in contact with the chest at all times. Make sure those hands are nicely on the chest. So the technique is to do 30 chest compressions at a depth of 5 to 6 centimeters at a speed of about 120 per minute. And this is about 2 compressions per second. To get an idea of how to do effective chest compressions, so this is your opportunity to please grab your pillows or a dummy. Try not to grab a family member in this case, because chest compressions can be will most certainly be painful. And we asked you guys, if you don't have a pillow or dummy to hand, then you can even grab some tissue rolls to press down on, because this gives you a good idea of how to do chest compressions. So I will now pass you over to Habib to do his demonstration. So keep in mind, Doctors ABC, the positioning points that I talked about and the technique of doing chest compressions. So Habib, over to you.
Hi guys, so I'll just give people a minute or so just to grab a toilet roll or a pillow or whatever they wanted to practice on, and feel free to show your video so that Tanya and Husna can have an eye on how you're doing chest compressions and give you some pointers in the chat. All right, so I'll just give it about 30 more seconds before I get started. Everyone ready? I'll get started. So this is an unconscious patient. I've just been randomly walking down the road and I see this person lying on the floor just like this. What do I do next? Mention it in the chat box so we can see if everyone's getting things right. Yeah, excellent. Doctors ABC. So I've decided it is safe for me to approach. There's no oncoming traffic. There's nothing flying towards my head. So it's safe for me to approach. Next is what I'm going to do. I want to check if they're responding. So I would say, hello, sir. Can you hear me? Can you hear me? I get no response. What can I do next? Can someone say in the chat box? What other things can we do to check for a response? Yeah, good. So I can give them a squeeze on their traps, in their shoulders, give them a good old squeeze and seeing if they're responding to any pain. You can also give them what we call a sternal rub. So using your fist across their chest, just like this, you can give them a good old sternal rub just to see. This will also cause pain. And usually if the person is conscious, they should be able to respond to that. Okay, so none of those things have worked. The person is still not responding to me. What do I do next? Waiting for some responses in the chat. Yeah, good. I shout for help. I need some help here. Can I get some help? So I'll get them help. I'll get them to call 999, and then I need to do the other steps. So my next step is checking the person's airway. So I'm going to pretend there's a head in this end. So I'm going to do my maneuver of head tilt, chin lift, making sure that the airway is nice and open. Next, I want to check for their breathing. So for their breathing, what I'm going to do, I'm going to try looking across their chest just like this. I want to see if it's going up and down. Whilst I'm looking at their chest as well, I'll be using 2 fingers. And as I mentioned before, I'll be feeling the pulse within their neck. So if you go to your Adam's apple, just here, and you go 2 to 3 centimeters to your right or your left, you should be able to feel what we call the carotid pulse. The same principle applies to another person lying here. So you go to their Adam's apple, 2 to 3 centimeters to the left or the right, and you should be able to feel a pulse for them. So at the same time, while I was watching their chest move, if it's moving or not, and I'll be feeling with their pulse at the same time as well, I'm also trying to listen and trying to hear if they're breathing or not. Now, I can't hear any of that sort of thing. So that means I'm concerned that the person is not, their heart's not pumping. So I need to commence CPR. So I need to first locate, where do I position my hands? Does anyone know? Does anyone listening to Tanya's section, where do I position my hands on their chest? Good, yeah, someone said it straight away. So I look for their armpits, and midway between the armpits, just right there, this is where I place my hands. So the positioning of my hands is just in this position, and the way I maneuver my hands is that I have taken my dominant hand, which is my right hand. I put my left hand and interlock it between my fingers, and then I lock these fingers down as well, like this. Then I place my hand onto their chest in the position that I described before, and then I'll start my chest compressions. Now, key things and very common errors that a lot of people do make is that they tend to bend their elbows like this and do chest compressions like that. This is a not effective way of performing chest compressions and doesn't generate enough power to actually help the heart. The key things to bear in mind is make sure you fully lock out your elbow. So you want to lock the elbows out and push down with your body like this. Okay? So how fast should I be going? Because someone mentioned in the chat, how fast should I be doing my chest compression? Excellent. Two chest compressions per second, and at the depth of 5 to 6 centimeters. Now, it may come across a bit pedantic, the 5 to 6 centimeters, but given that your experience, just try pushing down as hard as you can in terms of the chest compressions. Don't worry about breaking people's ribs, because if the person is frail, you probably will break some ribs. But in the context of things, trying to get their heart restarted is a lot more important than breaking a few ribs. So that's the main thing about chest compressions, and how you would continue until you see signs of life, which maybe if the person starts to move their hands, they might vocalize, which continue if someone is able to take over from you, or you will not continue until you're fully exhausted and you cannot continue any longer. That is when you would stop the chest compressions. Now hand back over to Tanya to highlight some key points, and then move on to the next section of our event.
That's great. Thank you, Habib, for that excellent demonstration. So whilst we're just waiting for the slides to come up, can people mention in the chat what some of the things that Habib did well whilst he was doing his chest compressions? He mentioned some key, so straight arms, really important. Good. So loads of people picked up on the straight arms. Fully interlocked hands, very good. Yep, locked elbows, brilliant. Okay, so you guys picked up on some of the really important things. Makes my life a bit easier in terms of covering the key points. So okay. So as we said, starting CPR early when you notice that your casualty is unconscious and not breathing is really a part of the chain of survival. And without it, the chain of survival breaks. If you see someone collapse, you start with doctor's ABC. You really can't go wrong with that. When a person is unconscious and not breathing, you start CPR immediately. In COVID times, hands-only CPR is fine. You don't need to do rescue breaths. And be assured that if you call the emergency services in time, then they will have the specialized equipment to give rescue breaths in a safe way for them and for the casualty. So effective chest compressions come from positioning the hand at the center of the chest, keeping the arms nice and straight, as you guys picked up on, and exerting all your weight on the casualty. The correct technique is to perform 30 chest compressions, each at a depth of 5 to 6 centimeters and at a rate of 2 per second. Do not forget to call for help, because you may have been trying to do chest compressions at home. In fact, I saw some people giving it a good go. If you do that for 1 or 2 or even more, for even longer period of time, which you may have to in the community setting, they can get extremely tiring. So you want someone there to be around and take over the responsibility. So thank you, everyone. Next, we're going to move on to how to manage choking. Now, choking is a very common scenario, and in particular, people often choke on their food. Does anyone know what kinds of, what types of people are more at risk of choking? Children, yep, babies, definitely. They haven't quite developed their swallowing reflexes yet. Good. Elderly, anyone with swallowing difficulties, or just anyone who's got difficulty in communicating. So I can see someone's put down dementia. So anyone who's not able to communicate to you that they are choking is particularly at risk. Great. So next, to demonstrate what to do when someone is choking, we're going to show you a little video. So I'm going to play that now, and then we will do the same, where we will end it with, we will end this session with some key points.
That looks disgusting.
Seriously, how many of them have you had?
No, was there like 4 on that plate?
Feels Saturday.
No, I don't think we're gonna go, is what she's trying to say.
Come on!
We don't sound that cute. We don't really
What do you mean?
I'm sure she's a great girl, we just don't know her that
She's
well.
really nice, and there's going to be lots of other people there.
Oh, maybe, it just doesn't really float my boat.
You should come for my sake, you know.
Are you okay? Okay, seriously, stop it now, just some water.
There's some vodka, what are you talking about?
Are you okay? No.
Hello, something's not right.
Try to cough. Are you being serious?
Try to cough out.
Are you okay?
She's not breathing. Come on. Just, come on, cough, breathe. Say something. Rebecca, breathe.
Rebecca, breathe!
Come on.
It's gonna go out!
She's going red. Cough. It's fine.
Just cough it out!
Rebecca here has a serious blockage in her windpipe. No air can get in or out of her lungs, so she can't breathe. Unless someone does the right thing, she could be dead in 3 minutes.
I don't know what to do. Just breathe.
What's going on? Come on, breathe! What do we do?
Are you choking?
Yes, it's choking.
Try to cough.
That's right. Ask the victim if they're choking and get them to cough. If they can say yes, or if they can cough at all, then things aren't too bad, because some air must be getting through their windpipe. If they can't speak or cough, then you know you've got a very serious situation, which is what we have here. So, what's next?
She can't cough. She's not breathing. She's can't. You just need to get it out of her. She's not saying anything.
I've got you, don't worry.
Come on, Becca.
Becca, come on, work with him! That's it, just cough it up! Oh! Come on, Becca! Come on! Yes, hold it up!
You've done 5 blows, you've checked Rebecca, and she's still choking. Time's running out.
Let's try this way, this'll work.
Right, you've seen this on TV. The Americans sometimes call it the Heimlich Maneuver, but in the UK, the correct term is abdominal thrusts. Stand behind the person, put your arms around them, and pull. If the abdominal thrusts don't work, you give up to 5 more back blows, though we're running out of time.
Come on, breathe then. What do you do?
Call for an ambulance!
Okay. Okay. Oh, she's breathing. Oh. Cough it out. Are you okay? Oh, it's all come out. Come on, Becky, try sit up for us, yeah? Oh. Come on, breathe. Come on.
Look at me.
Oh,
Are you okay? Are you
darling,
okay?
you brave girl. You okay? Oh, you scared us. Come here.
Does it hurt?
Oh,
Oh,
yeah,
thank
doing
you.
okay. You're safe. Oh, you're fine.
You're gonna stop eating those sausages now.
Okay, so I hope I hope that video gave you a good understanding of what to do when someone is choking. And luckily for Rebecca, she did manage to spit it out after all of the things they did. So we're just going to cover the key points to summarize what to do in an instance where you find someone might be choking. So ask the casualty, are you choking? If you suspect that they are choking and they're able to respond to you, then that's a good sign. Encourage them to cough, ask them to cough several times. And if that doesn't work and they still appear to be choking, you would try giving them 5 back slaps. So as you might have seen in the video, giving 5 back slaps is done through using the heel of your hand and placing that at in between the person's shoulder blades. And as it shows in this picture over here, you would bend the casualty over at 90 degrees. So each time you give a back slap, it's really important to check every time you give one to make sure that if the thing that was obstructing their airway has come out, then you don't need to continue with the rest of the back slaps. However, if the 5 back slaps do not work, then you would move on to giving the 5 abdominal thrusts. And just as the video showed, you would place your fist right at the center of just at the top of their tummy and in the center. And what you're trying to do is you would use a scooping motion as if to push out whatever is obstructing their airway. And if that doesn't work, then you would resort back to the 5 back slaps. At each point, be sure to reevaluate because at the moment they are breathing, although struggling. However, at any point, if they stop breathing, then you may need to resort to CPR, as we discussed in the previous segment. So I hope that gives you a good understanding so far of the recovery position, CPR, and what to do when someone is choking. Now I will pass you over to Martin Fagan, who will talk us through using defibrillators and where to source them from. So over to you, Martin.
Tanya, thanks very much. It was a really good session. For those couple of people that weren't able to see the choking video, we will actually make a link available so you can actually go back and look at those at a later date. Just to say a big thank you to the Resuscitation Council for giving us permission to use their videos, and those that are interested in looking at basic life support in more detail, if you go to the Lifesaver program, which is run by the station, training programs actually on there. So my session is really about defibrillators. As you gather from that last slide, there's actually many different types of defibrillator on the market. There are ones used in hospitals, there's one used in communities, there's all sorts of different ones around. So, you know, what is the right type of defibrillator to use? What type should you put in the community? What are the differences between them? So in very simple terms, you've got, you know, ones like this, you've got ones that look like this. Yeah, you've even got sort of very impressive bright green ones. The point is that they all basically do the same thing, which is they give a shock to the heart. And in the process of giving that shock to the heart, what it does is it actually stops the heart vibrating, and it sort of stops it and it thinks for a moment, and then the heart will start carrying on beating on its own. So a defibrillator does exactly what it says. It defibrillates. So the heart has to be in fibrillation in order for it to defibrillate. Yeah, makes sense. Now, one of the things that we tried to cover during the whole of this session was this thing about following a process. Okay, we went through the doctor's ABCD, but we also talked about a thing called the chain of life. And the chain of life, just to go back and re-emphasize that, is recognize that something's happening, that person needs the help, phone that 999, get the ambulance coming, start those chest compressions, because the chest compressions keep that person alive, and then the next stage is the defibrillator. Okay, so defibrillators are not difficult to use. You often hear the expression, you don't need to be trained to use a defibrillator. It's not quite right. The guidance actually says you shouldn't be prevented from using a defibrillator if you're not being trained, because they're so simple to use. All defibrillators will talk to you. Some defibrillators go further. In fact, the ones in communities should go further because they should actually have little TV screens on them so they can actually show you what's going on. And that's important because you don't know if a defibrillator is in the community. You don't know who is going to be the person using it. Okay, it could be somebody who is very competent at using them. It's somebody who's very nervous and very shaky and very stressed. They're certainly going to be in the zone, so they may not be listening to what they're going on. They may not speak English as their first language. They may be in a very noisy environment, so they can't actually hear what this machine is saying. So modern defibrillators all have television screens on them, whether it's this type or whether it's this type. They have television screens on them. And what I'm going to do is show you how a defibrillator works by using this machine to show you what happens. Now, all defibrillators have an on-off switch. So in this case, it's a little round green button. And they also have a shock switch, which tends to be a triangular orange or red button. Okay, some defibrillators you just open the lid and it switches it on, so that takes the place of the little green button. So what I'm going to do is I'm going to play you through the first stage of doing a rescue. Somebody's gone off to fetch the defibrillator, they've arrived on scene, somebody else is still doing those chest compressions, the defibrillator arrives on scene. What do? First thing is switch it on.
Call for help. Follow instructions to apply pads. Remove clothing from patient's chest. Locate pads package in back of AED.
There.
Tear open pads package. Peel adhesive pads from blue liner. Apply pads to patient's bare chest as shown.
Okay, so you get the idea. I'm going to cover my hand over the speaker now.
Remove clothing from patient's chest.
So if it is a noisy environment, or you can't hear it, or for whatever reason, you can still follow the visualizations on the screen. And it's telling you what to do. Let me just switch this off for a second so we can actually talk.
Tear open, powering off.
Okay, let me just put that down. So what it was actually doing there was telling you to do some things. Okay, the very first thing obviously was to take apart the clothing. Take the clothing off. So you've got a bare chest. Okay, it then talked to you about taking the electrodes out from the back. So you take the electrodes out, you rip them open, and those electrodes are on a long piece of wire. And those electrodes have little pictures on, okay, on both sides. And they will actually tell you very politely where to stick these. So it says, peel it from the blue plastic lining. So there's our electrode. And you can see from that, not only is it very silver, but it's also very sticky. Yeah, really sticky. And it tells you on those pictures where exactly to stick them. So I'm going to put one up here. Yeah, and I'm going to peel the other one now. Okay, so there's my little bit of blue plastic. And there's my other electrode. And that electrode also has a picture on there. And this one's telling you to stick it down just here below the ribs. Yeah, so if you can actually just see my screen, if I just tilt it down a little bit, you can see I've got one up here and I've got one down here. Now, if you think about it, what position does that remind you of? Yeah, what it is, it's a picture of somebody wearing a seatbelt in a car. So you're driving a car, you've got the steering wheel here and you've got the seatbelt that comes from the column here, touches you on the shoulder, goes across, leaves your body down there to the orange clip. So it's your seatbelt position. Yeah, one up here and one down there. Now, what's going to happen is the defibrillator, the computer here in the defibrillator, is now actually going to try and calculate what's going on. Once it's calculating what's going on, it will make a decision as to whether that person needs a shock or not. Yeah, so again, I'm going to play that for you so you can see what a rescue looks like in real life.
Demo mode. Call for help. Analyzing heart rhythm. Do not touch the patient. Stand clear. Shock advised. Charging. Press flashing shock button.
So there you see the flashing shock button now.
Press flashing shock button.
And if I press that?
Shock 1 delivered. It is safe to touch the patient. Begin CPR now. Give compressions.
Yep, so you see what it's actually doing. It's given the shock and it's told you to carry on doing those chest compressions.
Continue.
But it's also counting down from 2 minutes. So in 2 minutes
Continue
time,
for 1 minute 45 seconds.
2 minutes time, it will reassess the situation and decide whether in fact another shock is actually required.
Continue. Powering off.
So what you're actually doing is following exactly what that machine says. Now, a couple of questions have come in whilst I've been talking. One of them was, do you really stick them on clothing? Well, the answer is no, you don't. You've got to bare the chest. Yeah. So in reference to decency, of course, I've kept my t-shirt on. But in reality, you would actually get rid of that clothing. And in with your defibrillator are scissors to you to be able to cut away this and stick these electrodes actually on the chest inside. Yeah. Okay. The other question which came up on the question, the chat pane, while I was actually doing that, was what happens if it's a lady? Well, with all due respect, you're trying to save somebody's life. Okay, so it doesn't matter if it's a lady or a man or a child. You stick them on top right and bottom left. Okay, unless it's a very small frame person, such as a child, in which case you would stick it on the front and on the back. Yeah. So following through, okay, using a defibrillator is easy. You just do what it tells you, whether that's audio only or whether it's actually showing you pictures. But you very simply just follow those instructions as you go along. Joe, if we could go back to the slides, please. Right, big question then at the end of it is, assuming this defibrillator is given a shock, okay, and that shock has actually done something, okay, what happens next? So let's move on and look at some of the follow-ons from that. Okay, so reminder, switch the defibrillator on, take the pads out, stick them on the patient, and literally just do whatever the defibrillator tells you. Okay, so important things. The defibrillator will not give a shock unless it decides to. Okay, there's nothing you can do about this. This defibrillator, the computer inside here, will actually analyze that patient and decide whether that person needs a shock. Not every situation where somebody's collapsed and not breathing will the defibrillator give a shock. Only if it determines that that patient needs a shock will it allow a shock to be given. So you cannot influence this. Okay, you cannot override this. You cannot force a defibrillator to give a shock, not unless you're a medically qualified person. So don't be afraid to use it. You can't actually do anything wrong. If it doesn't give a shock, don't worry about it. It's normal. Okay, sometimes it'll say a shock is going to be given, and sometimes it won't do. But the computer in there has decided is giving a shock actually going to give any benefit to the patient? And if it is, then it will give it. If it determines there is no benefit to be gained, it won't give it. And it'll simply tell you to carry on doing the compressions. It will time you for another 2 minutes, and then it will reanalyze that situation. Okay. Also, a shock can only be given if the heart is fibrillating. What do we mean by fibrillating? We mean this quivering. Yeah. And basically, from the time the heart stops to the time where it's very difficult to bring somebody back, you've got this window of opportunity where the heart is quivering like a jelly. That's fibrillation. So a defibrillator can only work if the heart is fibrillating. Yeah. There are also some situations of very fast heartbeat called tachycardia, where it will also help. But the important thing to remember is you can never, ever harm a patient. Okay? Don't even worry about it. Now, how do we know that it's going to be successful? Well, if we think back to what Habib said right at the beginning about what represents a cardiac arrest, somebody collapsing very quickly, no sign of breathing, not responsive, gone a funny color, yeah, it's exactly the reverse. So you're looking to see after that shock, are there any signs of breathing happening? So is the chest beginning to move, for example? Okay, are the arms beginning to move slightly? Is there, some movement in the body? Those are good signs. Is there color coming back into the face or into the fingers? That's a good sign as well. Is the patient becoming responsive? Maybe. Not everybody who has a shock and is given a shock by a defibrillator necessarily recovers consciousness. In about 50% of cases, they will still be unconscious when they're taken off by the paramedics. But if none of those things, there's no signs of them breathing, there's no signs of movement, there's no sign of the color returning to the face, you carry on doing those chest compressions. Okay, the defibrillator will carry on monitoring, and every 2 minutes, it will actually re-advise you as to what it wants to do. No shock advised, give a shock, as the case may be. And you just do whatever that machine tells you. But clearly, if the patient is showing signs of recovery, okay, and there's color coming back to the face and there's movement, boy, do you feel on cloud nine. You're really happy about this because this person's recovering. And in this situation, you're going to put them back into recovery position. Okay, so let's just try and bring this together then. Defibrillators do save lives. They're really powerful bits of equipment, but they do it as part of this chain of life. The chain of life, again, just to emphasize that point, is recognize that something's happening, recognize that somebody's in cardiac arrest. Okay, phone that 999, get on the phone straight away to the ambulance service. They will ask you 2 questions only. Is the patient breathing? Is the patient conscious? Okay, if the answer is negative to either of those, they are now required to get you doing those chest compressions within 60 seconds of your phone call. That's how important getting into those chest compressions are. They will then advise you, if there's somebody with you, to go and fetch the nearest defibrillator from wherever is the nearest active and available defibrillator. And if it's in a locked cabinet outside, they'll give you the code to use it. If it's not a locked cabinet, then obviously you won't need a code to get into it. Bring the defibrillator, put it on the patient, switch it on, and follow those instructions. So defibrillators do save lives, but only really as part of that chain of life. So what I'm going to do here is I'm going to hand back to Habib and ask him just to take you through a little plenary and some questions. But we do have some questions coming up on the chat. What we'll do is we'll try and answer those questions for you and obviously give you more links to more videos and more things which you can do after the session and try and build up your expertise. So Habib, over to you, mate.
Thank you very much, Martin, and for Husna and Tanya for going through some very useful skills that we all need to know about in order to save someone's life. So I think what we'll do for this next part is we're going to do 5 questions just to test people's knowledge and just to see if you've been listening. And we'll give you 15 seconds for each question. We'll post it in the chat box and we'll see if people are getting it right. So is it okay if you control the slides for me? Because I'm pretty sure this is acting a bit temperamental for me. So the first question is, if you find someone who's collapsed, what is the first thing you should do? A, do you try to wake them up? B, check for danger? C, call for help? Or D, see if they are breathing? Okay, good. I can see most responses are saying B. What's the correct answer, Joe? Excellent. So the correct answer is B. So always remember your doctor's ABC. The first thing you always check in a scenario where you're faced with a collapsed patient is the danger. Okay. Next question, please. So how many chest compressions do you perform in an adult CPR? Is it A, 15, B, 40, C, 30, or D, 10? Excellent. Looks like people have been listening. So if we go to the next slide for the answer, yeah, it's 30. Next question, Joe. Thanks. So at what rate would you perform the chest compressions? A, 2 every second, B, 1 every second, C, 150 times per minute, or D, 200 times per minute? People are really quick. Yeah, good. I can see all the right answers. Excellent. 2 every second is the rate at which we perform chest compressions. Next question, please, Joe. Thanks. And so how many back slaps do you give someone who's choking? Is it A, 10, B, 2, C, 8, or D, 5? Good. I can see most people are D's. Yeah, good. That correct answer is D. Okay, great. Next question. So what would you do immediately before pressing the shock button as indicated by the AED? A, do you shout clear and press the button? B, do you continue with CPR? C, you try and wake them up? Or D, do you shout clear and look to make sure no one's in contact with the victim? Yeah, good. Most people are getting it right. Yeah, D is the answer here. Okay, great. So these are some further resources which will be sent out to everyone via email, just so that if anyone wanted a bit more further information about basic life support, feel free to have a look at these resources. Now, I'll be passing you over to Parvis to close the session today, and we'll be taking, I believe we'll be having some time for some questions as well. Over to you, Parvis.
Thank you very much, Habib. Thank you so much. Ladies and gentlemen, people, I think that was absolutely amazing from my point of view in terms of learning and making sure that went really well for you. Just before you go and before you actually turn off your cameras, I want you to have a look at the slide, because that will give you the QR code for you to get your certificate, but more so to be able to get more information. So here's the information that you will need. All of the videos that we have been talking about, the choking and others, are on the Community Heartbeat website. Please make a note of that. You will get that certificate of attendance from us. And if you've got your mobile phones at the moment, then if you sort of shower them over the QR code, that will give you an immediate link, and you can scan that on there and you can do your questionnaire, and it will immediately at the end of it will give you your certificate, which will come via email. Can I just say, on behalf of everyone that's actually been here today and all the people that have joined us, a huge thank you for joining us. I hope it was beneficial. You would appreciate that each one of these sessions would probably take hours to probably demonstrate properly. But on behalf of the Minutes to Save a Life team and the people that have organized this, thank you so much. Please give us your response so that we can, whether we ought to do this again and who for. And please get in touch with Community Heartbeat if you need any support. Finally, I would just like to say that the Community Heartbeat Trust, as you can imagine, that the charity has, lots of charities have lost a lot of money in all of this. Community Heartbeat Trust is a voluntary organization. If you can, please kindly sort of make a donation, that would be hugely welcome. Please keep sending us your message if you think that was really good. And on behalf of everybody, thank you so much. Have a lovely rest of the day. Bye-bye.
Tuning in from Cholton Uncle, well done, really well done. Really thoroughly enjoyed the session today.
Thank you. Thank you so much.
Thank you so much, everyone.
Thank you, it was brilliant. Thank you.
Thank you, Parvez, and all your team.
Thank you.
Really good session. Thank you.
Thank you. Thank you.
Thank you. That was very helpful. Thank you.
Thank you.
Parvez, well done.
Thank you. Thank you, everybody.
Thank you very much. That was great.
Really helpful.